welcome you today. And I appreciate the comments that you've made about the course, and we value your feedback. So we do ask you to do the evaluations, the course evaluations honestly, and know that you can put your comments and you won't offend us. One of the things I would like to just congratulate the class, I call y'all the fall 2016 class because that's the file you're in on my desk. And I looked last night at the just end of course reports, and I see that we have a 94 pass rate for the fall 2016 class. So 94% of you are going on forward to the spring 2017 class. You're a third of the way completed with a BSN degree. Go ahead and give yourself a round of applause. That's an accomplishment. And I know that sometimes whenever you look back, because you've been so busy, and some of you just feel like you were dog pedaling, trying to get through the semester, and you think, oh my goodness, I didn't learn anything there because I was just trying to busily get it, but I promise you that you did. And just from hearing the comments in the room today, I hear that you've learned a lot, so I'm very proud of that progress. The spring semester is going to be very busy also, and did some of you look at that and say, ooh, I just have 3 classes? Did you? Okay, well get ready. Put your boots on. Yeah, because it's going to be a busy semester. And 459, I know in your research in 360 you started writing those scholarly papers, and I hear that several of you said you'd been out of school a long time and you'd forgotten about APA format. And I told you why that was put back in our curriculum. We developed that and we put that in because what we were hearing from our graduates is they did not feel like they were prepared to write like students in their master's classes. So Dr. Mills took that and said, I'll get them ready for their master's degree. And I think that that class definitely does that. In 459, you're going to continue writing, and you're going to start your research, and you're going to work in groups. Can I get an amen? I know y'all love groups, but you're going to work in your groups to accomplish that goal. One of the things we've had from graduates before is they didn't get that total picture. They didn't know they had done a research project because they didn't wrap their head around putting it all together. But by the end of this summer, you're going to have your research project, and you're going to have participated in every bit of it. So don't just check that off your list of I don't have this part, I don't have that part. Look at what you're doing and trying to accomplish, and look at those numbers. And when you are out in your jobs, if you put thought into what you're doing, if there's a change, can any of you think of one change you'd like to make in your workplace? I see a lot of you shaking your head and saying yes. Well, yeah, if you look at numbers, like, why do you want to make that change? Just because it's out of convenience, that's not going to happen for you. But if you look and you learn from this research class and you start doing some research and start keeping up with some numbers, and you present that to your leaders, then that is the process that you've got to use to make change in your workplace. So that's what this is helping you to do. In 465, you're going to study communities. And it may not be your community, but guess what? It is a community in Mississippi. Miss Bascom don't want to hear, I live 500 miles from there. That is inconvenient, because where do you find a lot of information these days? On the internet. Every community is measured, there are censuses, the data is on the internet. So that will be the participation that you do. Now I can see me and Type A there, Miss Brandon there, we would be driving if it was 500 miles. We would probably call each other and say, let's just run on down to Yellowbusha, Mississippi, even though we've never heard of it or don't know what we're going to find. But I'm thinking that's probably what we would do, but it takes different people. The group will have to come together to collect data and then make plans. Look at that community and see what are the problems. And y'all, that's not just busy work. A lot of times I look at students that have not valued being able to do that community assessment. In nursing, when y'all started nursing, did you not learn the process of assessment? Yes, and then you started planning, and then you implemented change to make the patient better. Well, y'all, we can no longer wait for patients to come into the hospital to make those changes. We've got to look in the community. What are making people unhealthy? What can I do as a nurse to impact this population? So that's what community assessments are going to do to you, and then you're going to plan some change. One of the implementation, used to it would be whatever you found in that assessment, but one of the things that Joint Commission is going to be monitoring this year is antibiotic usage. Do y'all know that we are like making superbugs because we give too many antibiotics? Because what do mothers do when they go with their sick children to the doctor? They demand an antibiotic. Well, what doctor's going to say no? It's easier for them to write a prescription and say, move on to the next. And how many of you go to urgent care and you get a shot of Rocephin and Decadron? That's not helping you. Because most of the things you go to an urgent care center, Rocephin does not touch. But they give it to you because you think they're a great doctor because they've treated you with 2 shots. Well, Joint Commission says, okay, we got to get involved in this. And one of the things they're doing is they're going to be looking at antibiotic usage. Well, the CDC has come up with education. They do it for healthcare. They have education for communities. And y'all are going to take their presentations. The presentations are out there. There's flyers you can print off. And you're going to teach a community group about antibiotic stewardship. Y'all, there's volume. I mean, there's power in numbers. If there's 350 of you, and say if you only teach 10 people, how many people in Mississippi have been taught about antibiotic stewardship? Over 3,000. And y'all, those people then are going to teach somebody. So there is power in numbers, and that's one of the things as your class, you've got power because you've got numbers. You're going to do a family assessment. The family assessment's not for busy work. That's for you to evaluate your family. And I can remember being in my BSN program and doing a family assessment, and I realized that everybody in my family dies in their 50s of heart disease. Well, my eating habits and my lifestyle was pretty much set, but I made a decision then, and I said, I can make a change, and I can break this cycle with my children. And I've done that. And that's what your family assessment, maybe you can't make a change you can make a change, but maybe your eating habits and your lifestyle is set, but you can start implementing change in your family, starting with your children or your grandchildren. And the community, NU 465, that is the clinical course. And remember, on clinical, you have to have 85% to pass on clinical assignments. In those clinical assignments, you're going to have discussion boards that you have to discuss what you've learned and what you've implemented. And I thought this was a very good project. That's not a discussion. Y'all are not in junior high school, or community college anymore. You need to put in-depth discussions on the discussion board so that we can see that you did learn. NU 467, that's the leadership course. In ATI, you're going to learn how to do a business plan. You're going to learn about resource demands, and you're going to work on that portfolio. And in the portfolio, it's going to be category 2. And I don't know if you value the portfolio, but let me tell you, that is a reflective journaling assignment that gives you the opportunity to look at what you're doing in your career and think about it, and think about what could I have done differently. And in category 2, that's on communication and collaboration to improve patient outcomes. As a nurse, do you collaborate with others?
Yes.
Absolutely you do. But here's what I'm seeing with nurses. In their collaboration, a lot of times they are letting other disciplines make decisions that impact nursing. That's not collaborating, because the nurses are saying, I don't have time to go to the meeting, I got too much to do. Well, take time and go and help make decisions that impact nursing in the facilities where you work. Because I can assure you, the pharmacists, the physical therapists, and everybody else will sure make decisions for you. Until nurses decide, I've got time to do this, other disciplines are going to make decisions. And collaborating is not getting mad and throwing your arms, or I'm not doing that. You can't tell them anything. Nobody will listen to me. Well, if you don't act in a professional manner, nobody is going to listen to you. So decide that when you want to make change, and when adversity hits, don't get mad and cross your arms. Dig your heels in just a little bit deeper and say, oh, well, we're going to push this mountain right on off. And collaborate. You collaborate and you get your way with being nice to people, not by pouting and pitching fits. So collaboration, you're going to learn a lot about that. Also in category 2 of your portfolio, it has to do with prevention and population health. And we've already talked about the fact we can't just continue to take care of patients in hospitals. We've got to look outside the walls to figure out how to keep them out of our hospitals, how to get them well. And in population health in your communities, y'all, there's some exciting things that are happening in population health. You've got telemedicine that are coming to communities where people are being seen that are 60 miles away. You have telehealth in emergency rooms where there's rural, because we live in rural Mississippi. There's not a specialist on every corner and in every emergency room. So we've got to find ways to work smarter to take care of the people that we serve. And one of the things in population health is to look at their health over a lifespan in a variety of settings. How many of you work outside the hospital? Do you remember when nurses only worked in the hospital? What are some of the settings y'all are working in outside the hospital? Where? Nursing homes?
Home health.
Home health?
I work in the clinic system.
In the clinic
with
system?
population health.
Right. You probably do some of the population health, don't you, Amanda?
I do.
It's very exciting, the things that are going on. And insurance companies, y'all, do you know that like your physician is being reimbursed at a higher rate based on how much preventive medicine they do? If they don't talk to you about like those Healthy You assessments and stuff, if they don't talk to you about how to improve your health, they're not getting reimbursed as much as they could. Those physicians that are still just seeing sick people, they're not getting the full reimbursement. And it's about $175 difference per patient. So that's a lot of money in a day if you lose $175 on 10 patients. So those are some of the exciting things that you're going to be learning this semester. One of the things I want to remind you about is time management. You can't fly by the seat of your pants and do this program. You've got to organize yourself. Go home today. Take your calendar that you use for your work and your family and put your school, because it all has to mesh together. It's not separate. There's one you. You got to make it all happen. Know your advisor. There's people still calling in the office, and my first question's always going to be, who is your advisor? I don't know. Jan Taylor. She's not your advisor. She's our administrative assistant. She could probably give you a lot better advice than I can, but know your advisor. Read messages and emails. And I know you're busy, and a lot of times you see that it's a lot of information and you like, I don't have time to think about that today, I'm going to look at that tomorrow. Well, tomorrow will never come. And we can see how many times you go into your Canvas and like, so we tell you every 24 hours you need to be looking at your messages. If you do not have your Canvas messages coming to your phone, you need to call IT today and take care of that. We can tell who has it because when we send out a message, the phone starts ringing for those that have on their phone. Call the office. When you call the office, give us your name and that you're a current student. And I am so sorry that I can't remember everybody's name, but I just can't. And I can't remember where you're at on the curriculum because I have a spreadsheet that's got around 1,000 people on it with all the programs that I'm involved in right now with pre-nursing and the dual enrollment and y'all. So tell me where you're at on that. I'll be able to find you quicker. Do y'all have any questions or any concerns? Okay. One of the things I want to make sure that you know is that you have this RN to BSN resources. And when you pull up your courses, you should have RN to BSN. If that is not showing, you can click down here on all courses and just make a star beside it. Make this star bright and it'll come up. So go to your courses and then RN to BSN resources. I'm going to put it in the student view where you can see the same thing. Okay, so this is how yours will look. You've got the video from the fall, and we'll probably go ahead and take those out and then put today's video. Then you have class pictures. There's a picture of all of you who are here for orientation. So if you're talking to somebody in your group, you want to know what they look like and they don't have an avatar on their Canvas, then or a picture on Canvas, then look them up. Advisee list. Who did not know that was there? Nobody in the right mind would admit to that. Faculty phone list.
They got that.
They got and then here's your policies and procedures. A lot of times we'll tell you it's in the policy and procedure book, and right there that is. Here is your spring calendar. Remember what I said. That's only as accurate as I interpreted your calendar. So you're responsible for knowing what your class says. I was just nice enough to go try to put it on the calendar. But don't hold me responsible if you're late for an assignment. You're responsible for what's in that course in Canvas. This is like the person just took your math, science, and English and put it on one calendar. One of the things I wanted you to see is this add and drop form. If you're dropping a class, you mark drop. If you're withdrawing from the university, you mark withdraw, and then you complete all the other stuff. So I've got some directions on how to complete that, but that's not the form you send to us. You send the one, and this is a legal document, so you fill it out, you sign it, and you either scan it and email it to us or you fax it to us. And one other thing that I wanted to show you is how to go to the calendar. Okay, a lot of times we have people that don't know how to get to the academic calendar, so you click on academics there, and that says academic calendar. You click on that, and then the current academic calendar is 2016, 2017. And we're a full term. Sometimes we feel kind of accelerated, but it's a full-term course. And the things that you need to be aware of now is like the last day to add or register for a class. I'm in fall. Right here. The last day to add or drop a class is January the 24th. And there's several people that are in the wrong NU 459. Well, guess what? If you're in it by January the 24th, you're going to be in some serious trouble. So you better make sure that you're in the correct class. And if you're not in it by January the 24th, then you just won't be able to take it. And you will not be able to take the summer class and graduate. So you need to look and make sure you're in the right courses. Then there's withdrawal dates, and I don't know if you understand about withdrawing without a penalty, but there's a period of where you can withdraw. February the 16th is the last day to drop without receiving a penalty. And what that means, a lot of times, like if you call on February the 17th and say, I want to withdraw, my question to you is going to be, have you talked to that teacher to know if they're going to get you a WP or a WF? Because if at that point, if you're making an F in that course, you're going to get a withdrawal failing, and that goes on your transcript just like an F. It would be better for you to dog pedal and muddle through it and at least try to get a D if you know you can't get that C. Does that make sense? Because the D on your transcript will give you more quality points than that WF. It's going to give you a 0 quality points, but it's going to count for how many hours the course was. So that's why we ask you that question. And then after that date, there are things that happen, you know, like somebody may be passing, but they need to withdraw because they got sick or something happened in their life. So that's why we still have that WP there. There is going to be spring break. There's not any assignments there, but we will be here if you need us during spring break. One thing I wanted to show y'all is on March the 20th is when you start applying for December degree with a $50 fee. If you wait until April, you're going to pay $100. Well, I have several people that say, well, I'm not going to walk. It doesn't matter. You're still going to graduate. The $50 fee goes to the registrar, and you pay, I guess you're paying for your diploma, your whatever else that you're paying for, but it's $50 whether you walk or not. But do it early or you're going to pay $100. And one of the things that I encourage you to do is if you have taken courses at a community college or any other university, you need to get those transcripts in now, because when we start doing your transcript audits, if something's wrong with one of those courses and we've not had time to work that through with the registrar, then you may not graduate. Does everybody understand how to get to their resources? All right, well, I'm going to let Dr. Mills take over.